Advocacy groups say that Canada's drug policy is doing more harm than good and are calling on the government to repeal drug criminalization laws. A coalition of 8 advocacy groups say that Canada has a devastating drug policy. The groups have written to the health, mental health, and justice ministers. They're urging them to publicly denounce all forms of involuntary care aimed at drug users. Harm Reduction Nurses Association President Corey Ranger says the mandatory treatment of overdose patients infringes on individual rights. The letter says that the illicit, unregulated drug supply is killing an average of 20 Canadians a day. Well, joining us now to unpack Canada's drug policies and how they impact the likelihood of overdoses is Dr. Andy Hathaway, a drug policy expert from the University of Guelph. Dr. Hathaway, welcome to Forum Daily.
Thank you.
So, as we mentioned, advocates say that the current system is doing more harm than good in terms of tackling overdoses. So, let's talk about the current system. What do we know so far about the current laws and regulations around illicit drug use? And what do we know about involuntary care in Canada?
Well, I think they're right to be angry, of course, because many of them will know that discussions under Liberal governments have been going on for about 50 years in Canada, advocating for a public health approach to drugs. The fact that someone like me has to be repeating the same talking points 50 years later when we have the discussion about decriminalization and moving towards a public health approach, the fact that prohibition has been a dismal failure and in fact exacerbated many drug problems, made it more dangerous. I think these folks are absolutely right to be pushing back, to be demanding more. And of course, we have the opiate crisis as the backdrop for all of this. Whenever there's a crisis, more extreme measures seem more palatable, perhaps more reasonable. And I think this is the right window of opportunity to move towards some sweeping changes, as the province of British Columbia has done. And of course, talking about mandatory treatment just feels like a big step backward in that discussion. Mandatory treatment sounds an awful lot like criminalization, coercive treatment. The problem with coercive treatment, there may be in the short term some good news stories about folks that felt that they needed that to hit that rock bottom, that their interaction with the criminal justice system led to that. Of course, that feels good in the short term. In the long term, it's more a question of sustained rehabilitation and recovery. And that's difficult even under the best of circumstances where people come to it voluntarily and want that change to happen. When that is a coerced change, that's setting somebody up for failure, even though it may sound like a good idea in the short term. The compassionate thing to do. We really need to keep moving toward a truly public health approach to drugs, as opposed to stepping back towards more coercive and arguably punitive approaches.
Now, a lot of support behind this letter. As we mentioned, 8 advocacy groups have written this letter, but also 79 domestic and international groups have endorsed this letter as well. So I guess the big question is this shift toward what they're saying non-punitive drug policies, is this the right move here to address the overdose crisis?
Absolutely, for all the reasons I've outlined above, and the idea being that really we do need to provide support for people who are experiencing the kind of devastating life circumstances that might lead them down a road to abject addiction and all of the negative life effects that accompany it. Providing support, providing services, providing opportunities for recovery, while understanding that substance use many times continues and there will be lapses on the road to recovery. That is the tried and true method that has been seen again in other more progressive drug policy jurisdictions such as Portugal. So it's not surprising to me that the international community is advocating behind something that's been clearly advocated for by public health professionals for many decades now.
Dr. Hathaway, just a quick 45 seconds left here, but I definitely want to ask you, I know you've done a lot of research on drug policy, so what would the ideal strategy of decriminalization look like for Canada?
Well, let's try it along the lines of what Portugal, I think, is probably a good model. There's been mixed results in the state of Oregon. Mainly to my understanding, is there's significant social inequality in the United States, that countries like Canada and Portugal have more of a developed a safety net, more of a developed commitment to public programming of the sort, educational, occupational opportunities, steps that are required to reduce the social inequality, which seems to be the real heart of the problem, and something that needs to be addressed at the systemic level. Of course, treating drugs like a criminal matter does nothing to address that. In fact, it makes the problem worse.
Dr. Hathaway, thank you again for your time today on Forum Daily.